Keith Blair suffered from mild dementia, but it wasn't until after his death that his daughter, Marion Hollingsworth, realized he'd been given antipsychotic drugs.
It's a way of controlling them. It keeps them in bed.
Until that realization, Hollingsworth was puzzled by her father's rapid deterioration. He was given the powerful antipsychotics Risperdal and Haldol, but all without her permission.
Antipsychotic drugs are for the treatment of mental illness, not dementia. And now we've got studies that show this horrific outcomes for people with dementia that take these drugs, and yet they're prescribed just as much as they ever were, if not more.
Tony Chicotel is with California Advocates for Nursing Home Reform, a nonprofit trying to end the misuse of psychoactive drugs to control seniors.
And one way to make sure that they're not quite as demanding is to ask for pills.
The group created an online site which allows anyone to see how many patients are receiving psychoactive drugs at any nursing facility in California. But while these drugs are sometimes justified, there are dangers in their misuse.
When you see nursing homes that are above 90% of their residents are receiving a psychotropic drug, you're wondering what the hell's going on there.
So to find out what was going on, we had to go to the U.S. Department of Health and Human Services and find very specific information about the mental and physical condition of those living in nursing homes. We were expecting the number of people with mental illness to be roughly the same as the number of people receiving antipsychotic medications in area nursing homes, but the data reveals shocking differences at some facilities. For example, Collingwood Manor in Chula Vista had 57% of its residents on antipsychotics, but only 17% actually had mental illness. Granite Hills Convalescent Hospital in El Cajon had 51% of its residents on antipsychotics, but only 11% had mental illness. And Vista Healthcare Center in Vista had 43% of its residents on antipsychotics, yet only 16% had mental illness.
I think it's indicative of a culture, an internal policy of some facilities to use drugs as a last resort and other facilities to use drugs as a first resort.
We heard back from only Granite Hills Convalescent Hospital. The administrator said that all antipsychotics are prescribed by a doctor, given with consent by the appropriate party, and overseen by medical professionals. I'm Mitch Blocker, 10 News.